autism crisis. It is the first of, we have a response today to the autism crisis. It is the first of several chapters, but this is breaking news. You've heard some of it. The response to the autism crisis is going to continue to come to you under Secretary Kennedy's leadership, and the president wouldn't have it any other way, as you've heard. The FDA, based on NIH research, is approving prescription leucovorin for treatment of autistic children. Now, if you're following the script, there should be two questions that you have, two questions that should come to your mind. The first is, how will patients and parents get access to the treatment? I'll tell you how. Over half of American children are covered by Medicaid and CHIP, government health insurance, over half. And therefore, because they're covered in Medicaid and CHIP, upon this label change by Marty, state Medicaid programs in partnership with CMS will cover prescription leucovorin around the country. It's yours, but you have to go to a doctor to get a prescription because they know your child, they know you, and they know the medication. States will also have tools to monitor its use and ensure appropriate utilization. That's important for a bunch of reasons, because we want the right kids getting the right prescription medications. We believe private insurance companies will rapidly follow our lead if they have not already done so. And again, to make sure that this is safe and effective treatment, you need a physician to prescribe the medication because it's on prescription.
So I was just kind of wanting to address what RFK Jr. and Trump were talking about in their meeting about autism. And what people are overlooking, that is, if you're sick and you're pregnant, right? And, you know, let's say that you're sicker than you feel. Or maybe you're not as sick, but maybe your baby is kind of not getting everything it needs. And then you introduce like Tylenol. It may be perfectly fine for you, but may be toxic to the babies. Okay? And for some reason, maybe the medicine goes straight to the fetus or the embryo, whatever you want to call it. And if that happens during crucial stages of brain development, you know, it's going to like block things off. Like, you know, it's going to burn up that iron and, you know, slow down brain development. And then you cause like autism. They said, you know, and that's why you got all these spectrums, because there's different things that happen at different periods of time. And, you know, so a number of things can happen, like dehydration, high fever, you know, you get like gestational diabetes, right? So that can affect like the way that the fetus absorbs and your body absorbs these like this Tylenol or acetaminophen, and you know, so. You know, that's what they're saying, that you can literally make the baby toxic from that. They're not saying that that's the cause. They're saying that it can get toxic from it, and you have to be careful. And that's all they're speaking about that. And then on the and there's still brain development going on all the way up until the age of 2, post-birth, right? And so they're reiterating again, when you give them so many shots that they get sick and they need a fever, well, then once again, they're not able to process all this stuff that gets put in their body, and they get toxic, and the brain development suffers. That's their speculation. I'm not a doctor, but that's what they were saying. And I've been listening to RFK for a while, and that's what he's saying, is that you get sick and the baby cannot process the Tylenol, okay? And that happens, okay? It happens with a lot of drugs. You know, you get too sick to take it, okay? So that's not this static momentum thing that's concrete for everything. Well, I read this Harvard study, you know. No. The Harvard studies are done are a controlled environment. But in real life, people can get toxic from this stuff. I mean, if y'all know me, my son was in the hospital from getting toxic because he thought it was okay to take this stuff during when he had the flu, and he took this stuff, and it made him very toxic. He was in the hospital for a couple of days. I didn't know that happened. All right. Well, thanks for watching.